We are very happy to have you, Asha, to this discussion and that dialogue when we are transiting from 2020, when the world was caught in this sudden pandemic. And hopefully it will be a great year, 2021, when vaccine is there. So I think last over 2 decades, you have been advocating the power of community and for the health system, how community health worker is such an important force, or I will say a fundamental pillar. And so, and when this pandemic started, we have been discussing about all the clinical care when the vaccine is arriving, how to control it. But there isn't much of a discussion that we hear from around how to take the community along, because we feel that this community engagement is so much of importance in spreading away from the infodemic that is happening around, to build the trust, and definitely for all the prevention measure that we have been advocating. So do you think the countries have learned a lesson that this community, taking the community along, the power of the community is so much important, along with the clinical care or finding a good vaccine for us?
Thank you, Sangeeta. I'm really excited to be part of the series and to talk with you. I think it's a lesson that that countries are learning, but it seems to be a lesson that we keep learning for since Alma Ata. And we have to keep learning. Obviously, contexts keep changing, so it's good that we keep learning because we don't want to have any false assumptions. We need to adapt to new realities, and in different contexts, you might need to recalibrate how we work with communities. I certainly don't advocate for an overly prescriptive approach, but there are some core principles that are linked with trust, respect, that are universal. That if you follow a human rights approach, that it's absolutely essential to look at equity, true partnerships with community. I think those principles are universal, and we need to keep reiterating them, because in these, as you've seen, when crisis hits, people sometimes fall back on the more, I don't know that it's more familiar for some, but it's things that they have control over. And working with communities means trusting in processes and people. It's not about control. And so it's a different approach, and it takes time and trust, which sometimes takes a back seat when you're rushing to address a crisis.
And I think this trust will be really when the vaccine is in rollout. Like the experience of several countries to make this polio vaccination program. We found that it was such a challenge for countries to go to the last mile in making the country a polio-free country. Some of the country, like example from India. So when the vaccine is in a rollout, and when we give this whole vaccination box to the community health worker to go to the field and administer the vaccine. So how and what way the community health worker or the overall, I think the supporting structure, do you think should use the community or the leaders of the community, the governance system of the community as the first entry point? It shouldn't be just a top-down approach, oh, the vaccine is there, so just go and administer the vaccine, because there's lots of question mark about efficacy of the vaccine also. There will be lots of rumors about the vaccine also. So how the countries, do you think, should move ahead as the entry point to the community to administer the vaccine?
Sure. So I think we don't need to wait for the vaccine to do this work. It's an essential trust, and working with communities is a key part of health promotion. It's a key part of, if you're successfully rolling out testing, any kind of interface with the healthcare system requires trust with community partners. And so, yes, it will be vital for the vaccine, but it's a vital issue right now. And I think this is something that, yes, we have a lot of work to do in working with community leaders, working with community health workers, but the trust depends on having a strong foundation, a strong primary healthcare system that reaffirms public value, that reaffirms the public sector as a gold standard. Because the community health worker can't refer to a health system that's falling apart. So for me, it's not an either or. If you want to have very strong community engagement, very strong community health worker programs, they need to rest on a foundation of a public system that is invested in and strengthened, because that is part of the foundation. It's not the only foundation, but a community health worker otherwise is trying to engage with communities and is really sort of behind it is a facade, and people know. People then don't have confidence in what they're trying to do because there's nothing backing them up. So you need, yes, community health workers are an excellent entry point. Their relationships and support with community leaders. There are a whole range of different kinds of community leaders that are vital, not just the traditional leaders, but they also need to have a backup, a strong foundation in a public system that is invested in.
Yeah. And here the question comes, it is just not when the country is hit by an epidemic or a pandemic. This whole thing should be embedded in part of our health system strengthening that we have been talking about. And since Falmata, community health system should be one of the fundamental pillar for the overarching primary health care. So we have seen that the community health system needs to be embedded as part of our overall primary health care. And when we talk of embedding into the system, there's an issue of incentives that comes into the whole issue. It is just not the CHW, but if you are sort of involving other main community leaders, the health governance, this multi-sectoral approach. So how do you think that the whole issue of scalability, sustainability, countries has been discussing it for several decades. Now, do you think it's the right time to have a proper sort of a framework, why I'm repeating this financing thing, it's very much important, because once you administer the vaccine, oh, everything is fine, then we are sort of back to our original self, like all the clinical approach, tertiary care approach, we will go back.
So my sense is there's no going back. Yes, we might have a vaccine, but it is only a matter of time when the next potential pandemic could happen again. We are at a point of time where our economic systems, as well as the impacts of climate change, have really pushed the whole ecosystem in which we live in a very vulnerable position. So really, we have an opportunity to learn, to move forward in a way that strengthens us for the next response, where we don't know where it will happen, in what shape or form, but we need to look at how do we strengthen public sector systems, because their resilience over time is absolutely essential. And I know there's a lot of politics around political criticism of what the term resilience. But for me, there is a everyday resilience that is critical. It doesn't mean that you cope with minimal resources, but it is about supporting the public sector to have the autonomy and the critical thinking to make the kind of management decisions that are responsive to local populations. And in all of this, you mentioned the word investment, you mentioned the word incentives. For me, it's also about understanding interests. what are the political interests underpinning all of this? And that means even breaking down in communities. What are the interests of a community is not homogenous. So really understanding the community dynamics, what is in it for the different constituents that make up the community, what is in it for the health workers and the different sectors, water and sanitation, agriculture, transport. These are all different sectors that played a vital role in the response. And until we become more adept at understanding the interests of all these different actors and finding a way to facilitate common ground, that will be key to sustainability. I think all too often we make assumptions that we have a common ground. We might actually have very different understandings of the problem and what is the best solution. And I think therefore a more political approach to understanding different actors and what brings them to the table is absolutely essential to sustainability. And once we have that, then the issue of resources can be resolved. But you can't throw resources at a problem when there isn't that common understanding.
And it is very interesting when we talk about learning. See the examples that we are getting, how this community is sort of resilience and how it has sort of stood from a previous epidemic like the Ebola. Uh, there's lots of example that has come out from this Central and Western African region, Liberia and all. But this pandemic, it has cut across the geographies. And we have hardly seen any evidence from the Western hemisphere where communities are been really been involved into the thing. Now, do you think there is some reverse learning can happen? uh, how this so-called the global south has been sort of has, I won't say we have gone too further, but at least there is some foundation, some groundwork has been happening over some time. So do you think it is a scope also to learn some of the fundamentals from the global south to uh, to the Western countries primarily?
Absolutely. And I think community health systems has always been an opportunity for common learning and learning from the global south. I don't know if you remember, but in Liverpool in the Health Systems Research Symposium, we had a panel on community health systems, and we had someone from New York City speaking about the importance of community health systems in addressing chronic conditions for marginalized populations. I think there's a lot of learning. If you look at even before the pandemic, the extent of inequality in several high income countries, and even in Europe, if you look at refugee and immigrant communities, they have different health outcomes. We have a project, a collaboration that is South Africa, Uganda, and Sweden. And actually, the colleagues in Sweden have learned a lot from Uganda and South Africa in terms of community organization and community approaches to diabetes. So I think there's a lot of ground for learning. The question to me, I come back to politics. The question is also a political one. Can people drop their assumptions of that LMIC countries are handicapped or are weak, or that the only knowledge comes from the global north? And I think that takes a lot of a different kind of learning to start the conversation for people to be open to learning.
Yeah, I think there's a spark of inspiration from different parts from the global south, like South Africa, some pockets of India, I will say, from the state of Kerala. How I think some inspiration leaders have emerged and has put trust in this whole this community or the primary healthcare system, and it has showing some effect in this crisis. And So there is some example that you want to cite. I think there's number of information that is coming from South Africa, how they have been involved the community in the whole pandemic, and Kerala also. Some ray of hope has come out from there.
Certainly, and in Cape Town,
Yeah.
South Africa is the most unequal country in the world now. And we have a history, a legacy of apartheid that in Cape Town, although it's known for its beauty, it is incredibly full, it's just full of contradictions.
Mhm.
And the stark inequality is very much there. And I think what has been striking is, although I would say the government response compared to other governments was also very strong, and we have a very capable Department of Health in the Western Province, what was striking was the informal mobilization of communities, neighborhood by neighborhood, both in marginalized communities as well as middle and higher income communities, and how there was a network that was created that really looked at how do we share resources, how do we get food to, this crisis is not just about getting people tested and ensuring access to medical services. It was also about getting water to marginalized communities, getting food for people who have lost livelihoods. And in that sense, the community response was remarkable because it really addressed comprehensively. It wasn't a narrow sort of approach. It really problem solved and looked at what were the key critical emerging needs and responded informally. And that is something that I think we have a lot of, it's very inspiring, and a lot of lessons on how do you build that type of a community response and solidarity across race, class, and really address immediate needs through the mobilization of communities who want to support their own neighbors, their own families.
Yeah, yeah. I think this. I think if you sort of go ahead, if you, I won't say list down, but very three fundamental for from the community that we have learned over the past couple of months. I would say definitely you mentioned context is such an important issue when it cannot be fit for all across geography. But there's fundamental thing at the community level, if you want to sort of list down 1, 2, 3 points, how what we can learn. Definitely you mentioned about the political will, which is so much important.
I think also and this was emphasized earlier, Helen Schneider mentioned it at the symposium, or I think it was our colleague from Peru, the ability to listen.
Yeah.
I think so much, communities themselves, we need to be able to listen to what are the problems they face, what are the resources they themselves have, and without listening, we can't, that's essential to trust.
Yeah.
And I think also part of trust is looking at the history of engagement. Yes. And understanding that. So you might be responding to the pandemic right now, but the way people look at you, they see a history of prior engagements. And unless we understand that contextual, that social political context, people also will almost look at you with two eyes. Yes, they see your immediate response, but they will remember previous responses. And we need to be open to addressing misunderstandings and have the humility. It's a lot about humility of meeting people where they are.
Yeah, it is like carrying the community right from the inception of planning. You have to take them from this. It is just not coming and telling you should do this, or this is the messaging that you should just go and give it. It is they should be involved right from the beginning.
It takes
When
a
you
lot
are, yeah.
It takes a lot of time and I
Yes.
think sometimes time and respect. It is also iterative conversations. It's not a one-time engagement. And I think all of these things fundamentally go against the grain of our hierarchical health systems.
Yes,
So that
yes,
is part of the
definitely.
challenge, you know.
Yes,
It's
yes,
two
yes.
very different ways of functioning.
Yeah. Yeah, I think it will be, I think we are not over the pandemic, and it will be really a test now for the countries when they sort of go and deliver the vaccine. Again, I think they shouldn't forget this listening to the community, the trust they need to be built when they're administering the vaccine also. And this momentum or the embeddedness, it is a learning from every country across global north, south, that we cannot forget the power of the community.